All right, welcome back, everybody. We're so appreciative for everybody that's here. We've had some wonderful speakers this morning, lots of information, and we could go on for hours with it. I'm excited to introduce Dr. Pryor and Laura Bowden because I'm able to work with these two amazing people. And Yvette's also, I believe, up there with them off screen. But Dr. Pryor, in my opinion, has really taken the ball and running with breast implant illness. And he believes in it so much that he and Laura have really made a difference with showing surgeons what it's like to have a wonderful breast implant advocate, somebody who survived the illness themselves and take this to a whole new realm. These women get personalized treatment. And so with Laura up in Illinois and Yvette down in Palm Beach, and I'm over here in Florida cheering them on as another advocate and survivor. Dr. Pryor believes in this so much that he now only does explantation. Now, he still does some other cosmetic procedures, but he does not put breast implants back in anymore because of his strong belief and watching and witnessing what difference it makes to get the implants removed for women. So I wanted to introduce him. He is a board certified plastic surgeon. I could read his accolades forever and ever and ever. So we'll post those up so that people can see them because I don't want to take away from their presentation. If I sat here and gave you this 2-page presentation of his accolades and Laura's, then we would sit here forever. I do want you to know that Laura has been on television in the past. She was with Jenny Jones as well as Oprah, and she stood in front of the FDA along with a few others and about 80 women. And I was one of them to be blessed to meet Laura in person, hug her neck, and get to feel the vibration that she has. Dr. Pryor was attracted to that with Laura as far as being on the same page with breast implant illness. And together, those two have really built a dynamic explant team. And now he's expanded down to Florida in the Palm Beach area. So he has 2 practice locations for explants, and he has, I believe, 8 practices total in Pryor Health. And I just, without further ado, wish to introduce the 2 of them. I just love them dearly, and here they are.
Thank you, Anne.
Thank you so much, Anne. We're so grateful to be here. Your intro, it literally gave me goosebumps. I should show the camera because I think what you said is so true. You know, we can just feel the energy and know that we're really all working together to make a big difference and make a big impact on women all over the world that are suffering from breast implant illness. And certainly I couldn't do it without my great team. We've got Danica, who's our director of marketing here on a Saturday, kind of helping us get through this. And then, Laura, of course, who came in from the suburbs. She's under the weather, but is braving through the presentation today. I was actually supposed to be in California today, but we're doing this together because we're both here. And, Anne and I have had a chance to work together and just all these great advocates, Yvette and Nikki. And of course, thanks to Cicely for hosting this. And we just have so much to talk about. It's kind of tough to even know where to start. An hour's not enough time to really, even begin scratching the surface, but we'll try. This is a huge issue. And, like you heard Anne say, Laura and I have really doubled and tripled down on what we want to do with breast implant illness. Both technically as it relates to continuing to, you can go back to the other screen. Yeah. As it relates to, explanting patients, one by one and helping patients feel better, but also using our voice for people that, don't have the voice, don't have the resources, are looking for information. And I'll share with you too, my own personal journey now. I never had implants, surprise, surprise, but I did have my own kind of health crisis earlier this year. Actually, it's been about a year of 2024, where I, had my own health situations that, really enlightened me as it relates to what women go through with breast implant illness. I understood it previously from an intellectual perspective as a doctor and as a surgeon, but this last year and my journey through sickness and recovery has really allowed me to understand and relate better, I think, to all of the women that are going through this, and kind of knowing how challenging it can be to be sick and not know where to turn, not have the answers, and be gaslighted, and not have the medical system that's supposed to be there to support you and be your advocate, and make the recommendations to help you feel better, really provide any meaningful information. And it's scary. And so what we want to be able to do is, again, use our voice, use our resources, use our platform, which is, like Ann said, kind of a mixture of multiple surgical practices that we're looking to really grow across the country and focus in. It was founded on aesthetic medical surgery, but it's really kind of taken a strong dog leg to the right, so to speak, and we're really focusing in on building out explant centers across the country. I was just asking Ann about that before we all jumped on, because we really want to partner with surgeons and other professionals that believe in breast implant illness, do explant surgery, and are passionate about helping women with BII. So I think with that, we can proceed with the presentation. So what is breast implant illness? And I assume if you're on this webinar, you probably have an idea of what BII is. Generally, women get implants, and then a period of time later, usually in the range of months to years, but probably more like in the years category, people start getting symptoms they didn't have previously. And generally, it's not explained. That would be symptoms like brain fog is a big one, fatigue, joint pain, rashes, all kinds of neurologic symptoms, weight changes, particularly weight gain. And interestingly, this is a lot of the same types of symptoms that I had when I got sick. And the reason is because there's a common denominator, and we'll talk about that. I didn't have, like I said, implants, but I had plenty of other reasons to have systemic inflammation. And ultimately, that's what we're talking about, is goes back to the root cause. Why are people getting sick, whether it's BII or somebody that was sick related to long COVID or mold exposure, heavy metal toxicity. They all kind of have the same common origin and endpoint that results in symptoms. And so, great, maybe you get a diagnosis of chronic fatigue syndrome or fibromyalgia or rheumatoid arthritis or heavy metal toxicity or mold exposure, whatever it is. But at the end of the day, what we all want to know is, okay, what can we do about it now? How do we help ourselves feel better? Is it surgery? Is it detox? What makes the most amount of sense for reducing inflammation acutely, meaning getting all that out of the body, but then more long term, how do we prevent recurrence of symptoms, and how do we feel better so that we can take back our lives and get back to how we used to feel? So BII is not well understood, but there is increasingly more and more scientific information that has been validated and is coming out. And people like us are putting the pieces together, and through awareness that women are able to access from the internet and from social media, it's becoming increasingly popular. And for me, and I think for Laura, the biggest message that I want to get across to women with BII or just with breast implants is, number one, you're not alone. There is a solution to help you feel better. So, that's really important to know that, there's a resource, and, we can help you. There's lots of, well-intended physicians and surgeons out there that can help you feel better recovering from breast implant illness. And also, what we do very commonly too is, make sure patients know about the potential risks of getting breast implants. At the end of the day, I believe that women have the right to make the decision as to whether or not they want to get breast implants. And I believe that the surgeons have the right to put implants in an ethical way. And part of that to me is making sure that we're using appropriate informed consent, which is actually required, by the way, by the FDA, after people like Laura have advocated in front of them and made sure that that's a requirement
I do have to say it was made mandatory, not law. So unfortunately, as a lot of the advocates know, there's a lot of surgeons that are not following it. So we're there. We just need to tighten it up a little bit. Go ahead.
Well, we'll get to that.
We'll get there.
But Laura's been in this space for 30 years. Back in the day, she was out on a limb, right? Nobody was talking about it. Nobody supported it, not medicine, not doctors, not surgeons, not social media. There was nowhere to go and say, see, I'm right. So I give her a lot of credit for, really being decades out ahead of, this movement. You see Ann clapping. But really, she was one of the few people back in the day that believed in breast implant illness, and she didn't care what anybody said. And she was out there advocating. You can see her with her picket sign at the FDA, and this was because she went through an appropriate explant surgery by the grace of God and got her life back. And so I think all of us now are coming at breast implant illness from a similar position. I know Anne and Laura and most of the advocates have all been through their own personal journey with BII. And the reason that we're all so passionate about it is because we know that there is a solution and we can help women. And all we have to do is use our voice and our resources and our knowledge and, come together to empower women to take back their life. Go back. So as it relates to researchers, there's a lot of research out there about breast implant illness, and it's becoming increasingly mainstream. I connect with a number of professionals around the world, both surgeons, advocates, other specialties that touch BII, like pathologists and rheumatologists and neurologists. And so we're putting together, the data from multiple fields to ultimately, and actually have a meeting tomorrow about research in particular, and putting together all of these different specialties, because it is a multi-specialty, multidisciplinary approach to help patients feel optimal. And so as we continue to gain additional traction in the research community, and I think we'll see more and more studies come out, we'll share some of that with you today as it relates to the validity of breast implant illness, but more importantly, what to do about it. So this is the journey that Laura's been on since 1976, the year I was born. And
Thanks for that.
And I'll let her just kind of talk you through a little bit of what she's experienced over the last, 49 years.
You're such a brat. You're so funny. And I'm blind as a bat, so I have to get nice and close so I can see this. So we look back and we kind of wonder, how have we gotten to where we are talking? Like, where did it start? So back in 1976 to 1986, there was a woman named Mary Ann Hopkins. She was very, very sick to the point she was bedridden and going to pass away. She was suing Dow Corning. She would not settle with Dow Corning until the gag order was lifted of what the companies knew. There was internal documentation of what they knew about the dangers of these implants. So it's only because of Mary Ann Hopkins that she went to the FDA, she went to the commissioner, and the gag order was lifted. And that's when it came. That's where it was all in the media that they realized, well, these are not safe. So they were taken off the market. And unfortunately, with a lot of lobbying, they were put back on the market in 2006. So at the time that I got sick in 1992, got them out in 1995, I had made an appearance on the Oprah show, and I basically took on the CEO for Dow Corning. I do have to say, when I look back at that, there was little me, 28 years old. I was feisty.
Yeah, and if we don't have that link, we should definitely include that somewhere, because you get to see Laura in her prime, fighting the CEO of Dow Corning on Oprah, and as the story goes, they didn't know that the cameras were rolling, but I guess Oprah said, keep it going,
keep it rolling, yeah.
And Laura's like a little terrier with a bone; she would not let him off the hook.
Yeah. So that was pretty much the start of it. It's just when you know something is just not right, and you realize you've been spared, you stand up and you speak. And before social media, so I look back and little did I know, 30 some years ago, that my voice would somehow make a difference. So nope, not gonna start crying. So that was in 1995, and then in 2019, A lot had started happening on social media. Now, back in the day, we didn't have social media. It was we just didn't have it. I mean, it literally is social media is saving women. It is because of women like you that are throwing lifelines to other women. I really like to believe had we had that back in the 90s, I would like to think that we wouldn't be sitting here talking, except for the fact we are up against a very powerful industry. So, we definitely had a fight ahead of us.
And we still don't see it on, really
Oh
mainstream
gosh, no,
media. And,
no.
this is something I'm working to continue to bring awareness to and make it more mainstream. We were fortunate enough to just do an educational webinar with Dr. Pompa, who's got like a huge following on social media. And we expect to, continue to do other types of webinars like that to educate the public and really drive this to become mainstream, because now, seemingly with this new administration, hopefully the networks are more receptive to having these discussions.
Yeah.
That's kind of been what I've seen.
Yeah. Yeah. So, I think there's a lot of positivity moving forward. I always say we can't stop this truth train. Now, there's too many of us. We're too powerful. We're too strong. And it's an army of, not only surgeons and advocates that, the word's getting out. So I met Dr. Pryor, I came back out again in 2018, 2019, and I put my little VHS, right? My little VHS out in the BII community. Women didn't realize that we've been fighting for you for decades. So it became pretty much viral. And somebody had found out that I had been speaking about this for a while, and they were doing a documentary. And they asked me if I would like to be in the documentary. And we reached out to every single surgeon in Illinois to come and speak, basically enter the lion's den and speak to 20 sick women or women that got better like I did. And Dr. Pryor was the only one that showed up. And that's when I met him.
And I was still implanting at that point.
He was still implanting, yes. And he really didn't know that this was a thing back in the day.
I knew it was a thing, but it was very much discouraged by kind of the academic infrastructure and kind of poo-pooed for not being, very well scientifically supported. But just with my own kind of holistic personality and knowledge base, I wanted to learn more about it.
Yeah, yeah. So I taught him more about it. I showed up one day with my brown paper bag of studies back from the 90s and VHS and Jenny Jones and, Good Morning America videos. And, that was kind of where it started.
Definitely not something that, was obviously talked about in residency or fellowship. And I did 2 one-year fellowships. One of them was on breast cancer reconstruction, aesthetic surgery, a lot of surgery with breast implants, residency, obviously, but this was 2002, 2007. People weren't, and this was right after the implants got put back on the market, but still from a teaching perspective, everything's all good, nothing to worry about. Women want breast implants, so give them breast implants. And it really wasn't until we opened Pandora's box, proverbially, with Laura's paper bag, when she had like literally stacks of research articles going back decades. And going into that meeting, I read everything, I did my own research, and I was like, wow, there's a lot more here than I anticipated. And, that was kind of the start of really this BII journey that we went on together. And so, shortly after that time, we had patients coming in and wanting to be explanted with symptoms of breast implant illness. And I had done explant surgery previously, more in the in breast reconstruction, but not specifically for BII. And patient after patient that was coming in, this is before Laura, actually. I think I was trying to recruit her at this point, but she was not
Took me a year to
fully available yet. But we started seeing a lot of patients, every patient that got explanted appropriately got improvement in their symptoms. So that's around the time that I just said, I'm done with implants. I can't justify this anymore. Like, obviously, I just don't feel good about putting implants in patients, even with informed consent, knowing that they have a potential to get sick. And that was around the time that, Laura and I decided to kind of team up together and Like I've said before, it wasn't really like an intentional business model that we set out to grow. It just, kind of very organically grew itself as patients got better after explant surgery. Interestingly too, you'll see in a lot of these photos, I myself was pretty inflamed. I had a lot of things in my life that I think, were different stressors that caused me to be ultimately sick about a year ago. And it took a lot of intentionality to, kind of break that cycle. But, we'll talk about that a little bit. Like I said, at the end of the day, inflammation is inflammation and it causes symptoms. So we don't need to talk about me and all my credentials like it has in this PowerPoint presentation, but importantly, we are doing a lot of research on breast implant illness. We're utilizing medical students through the University of Illinois currently that are interested in going into surgery or ideally plastic surgery to, do a lot of the heavy lifting. One of our all-stars, just Danielle Rosell, she got a scholarship for underrepresented women in medicine. She got a grant to do research. Fortunately or unfortunately, she just matched in radiology. I couldn't believe it. She decided not to go into surgery, but these are the great minds of future medicine, and they're obviously very receptive to breast implant illness. We talk to medical students, probably like once a quarter, maybe twice a year, and after the presentation, we get inundated with questions and comments and interest. So there's definitely a lot of you know. Soon to be doctors that are interested in the breast implant illness space.
And on that, it's so important that doing that is we're educating these young medical students that are going to go out in the world and they're going to see the patients, they're going to see the women. It's going to be the rheumatologist, they're going to be the neurologist. And once they know, they're never going to unknow.
Right.
They're going to be like, oh, breast implant illness. I remember people talking about that. So
yeah, and we tell them that, we speak to like the audience of, whatever it is, 35, 40 medical students at a time. And we say, we know you're not all going to be plastic surgeons and you're not going to be doing explant surgery, but no matter what you do, maybe you'll be in the ER, maybe you'll be in a medical specialty, maybe you'll be in some other specialty that had, or a family member that has symptoms of BII. I mean, and that's the big connection that I want to make sure people are able to make. Like, I used to feel good. Now I don't feel good. What happened in the meantime? I got breast implants. Okay, it's not that complicated. I didn't, it's kind of like I didn't feel good. Not I felt good at one point, now I don't. What changed? Oh, well, I've got mold in my basement. It's not rocket science. So again, fortunately, women are becoming more aware. They can go to explant surgeons and detox professionals to help them clear the toxicity out of their body, reduce inflammation, and take back their life.
yeah, well, thank you for that. So this picture, yeah. So I'm going to start and kind of go through a little bit of my story, and I'll try to keep it as short as I possibly can. Implants put in 1990, had 3 kids, wanted the air put back in them, which the majority of women really, all we really needed was a lift. Got breast implants in against my husband's advice. He every once in a while likes to let me know that. Told they were perfectly safe. They would last a lifetime. I'd be 8 feet under, and my implants would still be standing. Well, that's kind of true, because they'd be as hard as rock on my chest. Total, absolutely healthy, 26 years old, aerobics instructor. Within 4 months, starting having symptoms of just fatigue, brain fog, inflammation. Within 2 years of having my implants, I gained 30 pounds. And this is somebody that was very, very fit. Word retrieval, bladder issues. I mean, all the symptoms that you'll be seeing in one of our slides. Every doctor you can imagine, nobody knew what was wrong with me. Anxiety, they wanted to put me on medication. How's your marriage? You do have children, everything that I know everybody sitting here.
They couldn't say you're getting older.
They couldn't say I was.
They couldn't say perimenopausal.
Exactly. So that's a great point. So for me, I'm so blessed that I was taken down so early, because the patients that we see now are in sometimes, although these new generation implants are taking these girls down, these gummy bear implants. Yeah, we'll go into that a little further.
I would say mean age is, 40s and 50s.
Yeah. So that's right the time. Well, my perimenopause, I'm not getting any. So unfortunately, it seems that these women suffer so much longer than the younger generation that gets sick. It couldn't be blamed on anything like that. So for 2 years, doctor to doctor, you lose your joy. And that is and another word I use a lot is your brain has been hijacked. something's just not right in the brain. It's almost like you feel like you're hungover every single day. So 2 years of going to every single doctor, it literally was this aha moment. I was standing in the kitchen and I thought, what is difference in my life? And I got breast implants. And it was really, it was that. It wasn't social media. Nothing popped up on Instagram. Nothing popped up on Facebook. We didn't have any of that. So I went back to my plastic surgeon. I made sure not to take my 600 Motrin 800s a day, which was what I was, trying to live on. And I went back to my surgeon and I just said, I'm very sick. And if it's my implants, please tell me. And he tapped me on the leg. Now. There's no scientific data to show that's why you're sick, but we'll take them out in the office under a local. I said, get them out of me. I was a week away from this man taking them out. And the younger generation probably don't remember who Jenny Jones is, but she was like the generic Oprah. So she was on. And there, every single symptom I had, she was sick from her implants. And underneath the TV scrolled a support group. And I called that support group at 9 o'clock at night, and a woman named Vicky answered my phone. And she was my angel. She was my lifeline. So speed that up. There were very few doctors back then that were acknowledging it used to be called silicone adjuvant breast disease. I believe it's changed 4 or 5 times with the title of it. My husband and I got on a plane, went to a neurologist in Texas. At that hospital at Baylor University, I met 3 floors of sick women just like me. Women that had ruptures after ruptures. They literally had silicone in their brain, their liver, and their kidneys. They were told, "What did you do? You must have done it yourself." Rupture after rupture, put a new implant in. Blame that it was their fault. So I started this little support group at the hospital. And if anybody's familiar or not familiar with Dr. Patton, if you watch the documentary Explant, Dr. Patton was my neurologist. He's actually a part speaker in the documentary. So that was very surprising when I saw it. There are 3 floors of sick women. Only by the grace of God, he knew a surgeon that was going to take out the capsules also. And I got my implants out, and within 24 hours, all my symptoms went away. All of them. It was like somebody took the cloud out of my brain. So I promised every single one of those women when I was coming back to Illinois, and I was going to be their voice. So, the rest is really history. We started a support group. The Oprah show found out we had a support group, and they called and asked us if we wanted our group in the audience. So if you do go to YouTube and you look up Laura Bowden on Oprah, you will see my appearance on Oprah. And then in 2019, you'll see I had the pleasure to speak with Ann and 80 other beautiful advocates. It'll share in the comments. 30 years later, then the fact that we're still talking about this just literally blows my mind. But honestly, everything that we're doing and the team that we have and the army that we have, I cannot be more honored to be on a platform like this with all of you. So thank you for everything that you do.
Okay, so we probably don't need to get into a lot of this, but safe to say that there's a lot of shit in implants.
Yeah, there you go. What could possibly go wrong sitting in our most vital organs, our lungs and our heart? What could possibly go wrong?
Yep, there's a lot of implants. And so, as it relates to breast implant illness, we believe that there's probably multiple pathways that are ultimately leading to chronic inflammation, whether it's heavy metal toxicity, hidden infections, mold, maybe more so for saline implants. But it's usually not, just one thing. There's, multiple variables in people's life, usually emotional, physical, or chemical stressors. So we've talked about some of those, even maybe, getting older, your detox pathways start slowing down. Stress, affects the body negatively. Maybe you're living in a moldy home. Maybe you also have toxicity from the food that you're eating or the water that you're drinking. I mean, we're learning so much more about all these other potential sources of infection and biotoxin and neurotoxins that, this is just throwing gasoline on the fire, right? I mean, I feel like where I was, I was kind of just getting by day to day. I probably had a lot of inflammation, but it wasn't at the point where I was experiencing a lot of symptoms yet. But everything adds up. Now, my particular story started with a tick-borne infection that I contracted last May, about a year ago, and that just threw my immune system into overdrive and, really kind of just brought the majority of the symptoms out. But, it's different for everybody. And that, in my opinion, is why, some women like Laura get sick very quickly. She also had She has a genetic predisposition called MTHFR, which is, her detoxification pathways are not optimal. I have MTHFR also, a little bit of a different variant, but, everybody's different. Everybody's genetic makeup's different. Everybody's ability to detoxify, everybody's environmental stressors, alcohol, food, like we talked about, mold, other infectious etiologies, everything takes a toll on the immune system. And so when you put breast implant illness in a susceptible patient, like Laura said, what could possibly go wrong? So we'll tell you a little bit about one of our patients, and this really highlights, I think, a lot of what we were just talking about, where it doesn't have to be like your typical middle-aged woman that has social stressors and maybe anxiety, depression, other variables leading to their illness. This is somebody, interestingly enough, exercise itself is a stressor to the body. It causes inflammation, but the body adapts to it. And so, that's something else that may be predisposed, this person to getting breast implant illness. But she went from being perfectly healthy to being basically bedridden, and then return to competitive bodybuilding following explant, correct?
So she actually never went back to it, but she could have because she was healthy. The important about this is this was the patient when you decided to no longer put implants in. It's because of Francine.
Okay.
It was like, you know what, I'm done. I can't do this anymore.
Laura remembers this stuff.
I do remember this stuff. Mm-hmm.
So, you want to share her?
We're going to do her video.
Okay.
Yeah, we're going to do.
Okay.
Symptoms.
We'll cover that later. So we talked about this a little bit. I'll let Laura talk about, the eye symptoms, because I think we're probably the only practice that has kind of identified and is talking about, how it affects the visual changes in the eye. Sorry, the visible changes in the eye.
Yeah.
Insomnia, a big one. That was one of my main symptoms. Fatigue obviously goes along with that. And what happens is when you don't feel well and you don't sleep well, it just exacerbates the symptoms that much more. You're not exercising, you're not eating healthy, you're under more stress, everything kind of compounds. But you can see here, a lot of the, common symptoms that we see. And the problem with breast implant illness, like some of these other conditions that we've talked about, mold and chronic fatigue and other inflammatory conditions, is this kind of a diagnosis of exclusion. So, we don't tell patients definitively you have a breast implant illness. We say, your symptoms are consistent with breast implant illness and you have breast implants and the timing makes sense. So if you want to, see if this is related to your breast implants, we have to do a pretty big surgery, take the implants out, take the capsules out, and, see if you feel better, but there's no guarantees. And that's challenging for a lot of women. And that's why we have advocates like Laura that, take them through this journey and work with them to make sure that we're setting appropriate expectations along the way.
You know what Dr. Pryor was just saying, the eyes, I always use this analogy, is the eyes are the window to the soul. We literally, there are times we actually see their eye color change. They go from like just dull and they just kind of lose their life to actually vibrant again. So it goes back to, I continue to say, it's almost like the inflammation from the top to the bottom. When we take the logs off the fire, the body's able to calm down.
And it's amazing how quickly that happens.
Oh, sometimes within 24 hours.
Even within, in the recovery room, like literally as soon as the implants come out, which from a physician's perspective, that's not like entirely surprising. I don't know if you guys have ever gotten like an IV, and specifically, have you ever gotten like one of those IVs where you can actually like taste it in your mouth within like seconds of it like going into your body? It's just amazing how the body works. So, that just goes to show that, the body's responding in real time to what's happening in the body, to what's happening to it. And so we see people right away in recovery starting to feel better. So, these are, again, we don't have to like continue to dwell on the symptoms, but they're non-specific. And our research that we've done internally also shows a correlation, most notably to the cognitive neurologic symptoms. And that makes sense, having talked with, Dr. Pompa, who's really big on neurotoxicity, a lot of these heavy metals that are found in implants are neurotoxic. So that's not surprising why we have these types of neurologic symptoms. So how do we take the implants out and ensure our patients the best chances of feeling better and not experiencing problems down the road? This is something that is still controversial as it relates to, the capsulectomy or the necessity for capsulectomy. What I can tell you based on my knowledge of breast implant illness, having read now dozens of scientific studies about breast implant illness, the utility of capsulectomy, having experienced it firsthand as a surgeon, having treated personally hundreds of patients with BII, and much more than that as a center of excellence. The capsules have to come out. There's a lot of reasons behind that, but at the end of the day, that's what patients want. That's kind of the position that the advocates take, and rightfully so. And in my opinion, they know best. They're interacting with the patients. They know what these patients go through and how common it is for patients that don't get explanted properly, don't see improvement in their symptoms, and sometimes it can actually make their condition worse, which you'll see in one of the videos coming up. So, the short answer is, the capsules are the protective layer that the body creates to, wall off this foreign invader. And it's not unique to breast implants. It's with any foreign body. But the problem is this tissue, this capsule that's formed is inflammatory tissue. It's made up of inflammatory cells. It's called multinucleated giant cells, which are essentially macrophages, kind of the workhorse of the immune system, other B cells, T cells. And so it's literally inflammatory tissue in the body. So as we try to reduce inflammation in the body, to me, it makes sense to take out a potential nidus of infection. Not to mention, I believe leaving behind capsule can also predispose patients to other issues with delayed healing and infection down the road. But even more importantly, in my opinion, and this is something that's pretty well discussed and documented now, is, the capsules can have hidden cancers. The most popular one that people talk about is BIA-ALCL, breast implant associated anaplastic large cell lymphoma, which is a lymphoma that actually is found within the capsules around breast implants. And it develops because of the inflammatory process that turns on defective genes, and ultimately, in my opinion, leads to hidden cancers, other cancers that have been identified in the capsules. But that's not unique to breast implants. Cancers typically develop in areas where there's chronic inflammation. We see that over and over again. So, the patients want the implants out, and the capsules out. And by taking the capsules out, that allows us to have them studied histologically and confirm that there's no hidden cancers there. And finally, and this to me is the most obvious, we want to make sure that if there is a rupture, and a lot of times with silicone implants, there can be a silent rupture, meaning it's not something that's detected clinically. And sometimes, usually patients don't get MRIs ahead of time, but even if they do, it may not. We've had plenty of patients that have had negative MRIs prior to explant and found silent ruptures during explant. So, if we had not treated those as total capsulectomies, en bloc is a word used in cancer surgery, but as it applies to taking implants out for patients with breast implant illness, it means taking the implant and the capsule out altogether. So that means that, we don't want to have any of the contents of the implant spill into the body cavity as we're extracting the implant, just like you don't want to have a cancer spill into the body cavity when you're taking a cancer out. That's where the terminology comes from. And if it's not done in that way, in my opinion, the patients, especially ones with potentially silent ruptures, have a much higher incidence of having some kind of contamination of the chest cavity, which would lead to exacerbation of symptoms, like we'll see, later in this presentation. So I think that's, critically important. And it is something that patients need to be aware of, because it is a more complicated surgery. It takes longer. There's more recovery. There's more risks, because it's under the muscle, and we're taking out the implant in the capsule. This is a very, very commonly asked question. We have to, quote unquote, scrape the ribs to get the capsule out. and it puts patients at risk of having a pneumothorax. Now, that's not common, especially in experienced hands, but it's definitely possible. But again, in my opinion, it goes back to informed consent, risks, benefits, alternative to treatment, as long as we're, doing what the patients are requesting through an informed consent process, and they understand the risks and the benefits, just like with anything, just like with getting implants. You want to get implants, you want to take the risks. It's interesting. I mentioned on another podcast, I have, full mouth crowns. And, maybe that predisposed me to have chronic inflammation. I don't know, but it was something that I went into knowing that, I'm putting glue in my teeth, right? So God knows what chemicals are in there, but, it's something that, I did. Just like if, a patient gets aesthetic plastic surgery, they don't like their appearance of their breast to begin with. That's why they get implants, or they don't like the appearance of their body or their face or their nose or whatever that issue is, as long as they understand, the risks and the benefits, to put their body through that stressor. I think it's appropriate, although, it's not the right choice for some women. So again, this is, my opinion, why the scar capsules have to be removed. And, doing this in combination with a detox program that minimizes risk of recurrence of symptoms, and gives patients the best chances of healing, because, this inflammation, although it started in the breast, is now throughout the body. That's why you see the weight gain. That's why you see the hormone irregularities. That's why you see all these symptoms. So, we can remove the source, remove the implant from the chest cavity, but we also have to treat the body holistically to make sure that this inflammation that has built up, and the detox pathways that have essentially shut down, can be restored after explant. So this is not common. We see this. You got that? This sounds okay. Okay. So this is not common, but usually when we take implants out, we don't really notice a difference, and that's a commonly asked question. Like, what did you see, on the implants? People expect like this is what they're going to see when they explant, like some really nasty, implant with like mold popping out and heavy metals spilling out. I mean, the reality is we just don't typically see that. This is a pretty, worst case scenario. These are really old implants, and you can see that calcification, but these are capsules that have been opened after a quote unquote en bloc capsulectomy. But I don't think anybody in the audience would want to leave those capsules behind in their body. I mean, if your surgeon could show you ahead of time, yeah, we can leave the capsules behind. This is what they're going to look like. What do you think? No, thanks. I think I'll get my capsules out.
Kind of what Dr. Pryor is saying, the majority of implants that we take out many of them look like the day they were put in. So, I mean, that's, we do show more like just for educational purposes, like, and you'll see some slides forward, but
there's no way to know this until
No.
you take them out.
no, exactly. Good.
So here's kind of a normal, you can keep going. I'll talk over it. Here's kind of a normal looking explant. So implant looks normal. Capsule looks normal. It's thin, meaning there's not like a capsular contracture, which is kind of also part of the inflammatory process. We don't see any, mold or anything really scary in the implant or capsule, but that capsule, needs to get sent to pathology to confirm the absence of any of these cancers that can be hidden in the capsule. And so, this is really important, and patients request it. So being in the aesthetic industry, we're in the business of customer service. As long as we can do surgery ethically and set appropriate expectations. And like I said, this is what patients want. They want to see that their implant's been removed. There hasn't been any spillage of contents. All of the capsules been removed, and it's very important for their mental health as well. We talked about the emotional stressors that can also exacerbate these symptoms. Surgery itself is a physical and emotional stressor. And so we do everything we can to make sure that the patients can, try to get back to their normal life and not have to stress about the possibility of leaving behind capsule, or, maybe there's a hidden cancer that I don't know about. Who wants to deal with that?
important too, by the time the women find us, they've done better research than the FBI. So they already know everything that these need to be done en bloc, total capsulectomy, that they need to come out. They've done their research. They've been their best advocate. Yep. So here we have 12-year-old saline implants. Patient was having very, very thin capsule. As you can see, you can actually see through that capsule.
Doesn't affect the symptoms, right?
No, it does not affect the symptoms. Some of our patients have the thinnest capsule and are so very ill. She had terrible muscle twitching all over her body, fatigue, dry eyes, all overall just feeling absolutely terrible.
And so if you look at the capsules under a microscope, you know what you see? You see inflammatory cells. That's what's in the capsule, in addition to collagen, which is recruited by the inflammatory cells. But, it's basically the body's attempt to wall off this foreign invader, and it's unable to do that. And that's really what leads to this chronic inflammatory response.
So this patient had silicone implants over the muscle for 45 years. Dr. Pryor did a beautiful total.
I heard a really good. I heard a good saying by Andy Liu in her podcast with Dr. Pompa that I really liked, which is, the body's natural defense mechanism is to expel, right? So when we get sick, what do? We sneeze, we cough, we vomit, we have diarrhea. Like, the body's like, get out, right? And that's really what we're trying to do with implants. But unfortunately, we don't have the ability to get the implants out of the body. So it causes this immunologic dysregulation.
Inside.
So 45-year-old implants,
Yep.
right?
Yep. She's not sure.
We know this is ruptured from preoperative imaging, right?
Yes.
So you can see here, as soon as he's cutting into the capsule here, see that?
Crunch.
That's a ruptured implant. That means usually with these really old implants, the shell is essentially disintegrated. I think you'll see that here. And the silicone is basically free floating in the capsule, which leads to capsular contracture, which leads to exacerbation of symptoms. But I mean, to just make an incision and pull an implant out, leave behind silicone and leave behind those nasty capsules, to me, is not a meticulous surgery that should be getting performed by somebody that's really trying to alleviate symptoms of breast implant illness. Look at that.
Yeah.
I think this was mine, actually. This was another really old implant. And, I don't know what's in there, but it's pretty disgusting. This was literally inside the capsule.
And this patient had a capsule contracture that literally was up in her clavicle.
Yeah, I remember. For like 45-year-old implants.
Yep. Again, just disintegration of the shell. Again.
We do see, I'd say, the vast majority of patients with breast implant illness having saline implants, and we don't obviously know why. And a lot of patients think that it's only silicone implants. But the interesting thing, as you can see, is there's no saline in here, and there is a silicone shell still. Right. So, and the interesting thing about saline implants is they have this valve here. Yes. And so, you can see that is potentially, and obviously we don't know this yet because nobody's really researched it, but that is a potential nidus for colonization of different pathogens, bacteria, fungus, and you can see, I don't want to say the M word, but that could be some mold on the implant.
That's
and
what I
obviously it's been a year, so it's tough to say exactly what it looked like when it came out, but this is a mobile a piece of the device that I think does have the potential to colonize contaminants.
And we see a lot of that mold on the saline implants when we take them out. So the valves, faulty valve, they've known for decades. Breast implant illness does not discriminate. Doesn't matter if you have saline implants or you have silicone implants.
Yeah, that's right. And like I said, I think it's probably parallel paths to the same endpoint, but potentially from different for different reasons. I believe with the silicone implants, obviously there's the element of potential heavy metal toxicity. You heard me talk about the potential for mold and biotoxins with the saline implants. Um, Gummy bear, is basically a silicone implant. It's a quote unquote highly cohesive gel. The thought was that it's not going to spill into the chest cavity because it's more highly cohesive if there were to be a rupture. But Laura can tell you, she sees some of the sickest patients with these newest generation implants.
So this patient, back for 1 second, this patient here, his name is Lucy. She actually had gummy bear implants that were ruptured, that a doctor left the rupture inside of her. And then we took a
Well,
set out
she
of her.
explanted and
She did explant it.
Yeah.
We took a set out of her, but the damage had already been done. So a lot of the images you're going to see
because she had a rupture.
because she had a rupture of the gummy bear, which we found out that is in her tissues. It was sent to Dr. Henry Diekman. I know all you beautiful advocates are very familiar. We sent tissue samples, and there is silicone in every tissue of her body, and she's actually still bedridden.
Well, let's keep going. I know
Francine.
we're a little bit short on time here, so go back,
Go to
Danica.
Francine's store. No.
Go ahead.
That's
So
our Lucy.
This was the patient that Laura was talking about that had a undiagnosed silicone rupture and improper explants without capsulectomy and is still sick today.
She literally has silicone come out of her skin.
Yeah, Laura told me, she takes a bath and like literally the bath water when she gets done is like filled with silicone film. And so I did a skin biopsy and it came back consistent with silicone.
And I know this story very personal because she's actually lives with us. She's part of our family now. She's going to be homeless. Yeah. This is a thermogram. Her left side was ruptured. You can see the inflammation of where the silicone was left inside of her body. This is actually the thermogram after, and we'll talk about this at a later time if anybody's interested. But true dose, it was a therapy.
Yeah, I think
that we
the
used.
point here is this is kind of a before and after an intervention. We use Trudeau's here at Pryor Health. It's something that I've used personally for many years. It's kind of like intravascular PRP, but at the end of the day, it's treating inflammatory mediators, reducing this kind of quote unquote cytokine storm, and reducing the inflammation in the body, like you can see in these thermograms. So it's not a permanent solution, but it definitely helps patients, a lot of the symptoms related to BII. So we talked about informed consent. That's something that, I think we're really passionate about. We know that it's not realistic to take implants off the market. We're not expecting that to happen anytime soon, but the best thing we can do is make sure that patients that are getting implants and patients that have implants that don't feel well understand the risks about BII. And it's not that hard. It's like you're getting implants, you're getting a foreign body. There's risks of rupture, there's risks of contracture, there's risks of, just like anything else, infection, bleeding, and breast implant illness. We don't have time to go into a lot of the research details today, but we're kind of evolving our breast implant illness site as we expand our practice, and our practice is unique in that we have the ability to actually bring on practice partners across the country that specialize in explant surgery. And we're going to use the Breast Implant Illness Centers of Excellence site to be a resource to patients that are looking for reliable information, obviously as it relates to research, but also, different therapies that can help them feel better both before and after explant surgery. And of course, we've got, a number of, really technically gifted surgeons and advocates as part of our BII Centers of Excellence. And, right now we're out of 2 locations, primarily in Rockford, which is out of Chicago, and Palm Beach, where Yvette is as my advocate down there. But, again, we're looking to continue to expand and bring awareness to breast implant illness across the country. next generation of talented explant surgeons. And, we know there's more of them out there. And I think a lot of the plastic surgeons are really starting to understand that breast implant illness is a valid scientific diagnosis. I've read all the research myself, so I can confidently say that this is a real thing. And, we are in the unique position to be able to help, a lot of women, which is very rewarding, doing aesthetic surgery and helping people feel better through the lens of appearance is great. But, when you can actually help somebody restore their health, to me is an entirely different, philosophy and mindset and, purpose. And it's really kind of given me back, my interest in doing these reconstructive surgeries, to try to help as many women as I can. So it looks like we finished right about on time. I want to leave a few minutes for questions. Lots of questions. I'll try to answer as many as I can if we have time.
So one of the questions is, does it matter if I have saline implants? Again, breast implant illness does not discriminate. We see the illness the same with saline or silicone. We do see a little bit more of the struggle, a little more difficult with saline implants as far as detoxing. I totally, and Dr. Pryor kind of touched on this, it's systemic, it's mold, fungus, and bacteria. So they definitely have a little bit longer road than our silicone patients is from what we're seeing. I have implants, but I don't have symptoms. What should I do?
Yeah, I'll take that.
Oh, go ahead.
Common question. I have implants, but I don't have symptoms. So let me break that down into a couple parts. I think I would put the caveat that I don't have symptoms that I know of, right? And so a lot of times women come in and they say, well, I want, I want to change out my implants or I want to take my implants out, but I don't have BII. So, that's not me. But then when we have a symptom sheet we go through, it's got, 50 plus symptoms on it. And we start asking patients, more probing questions about, how they feel now versus how they used to feel. And very commonly they do have symptoms. They're just unaware of it. But, let's assume that they don't have symptoms. I don't want to say it's a ticking time bomb because that sounds kind of dramatic, but I do think it's a stressor on the body. And everybody's body is going to respond differently to the implants. So it may be a week, a month, a year, 10 years, 30 years. Maybe you never get symptoms. Maybe you're somebody that has excellent detox pathways. You got your health dialed in, you exercise, you eat perfect. You do your detox regimen and you're able to compensate and never actually develop symptoms. So, it kind of just depends on the individual. And, again, going back to informed consent, I would tell the patient, you don't have symptoms now. That's not to say you might not get symptoms down the road, but at least now you know that if you get symptoms and you start noticing you feel different, brain fog, fatigue, weight gain, rashes, joint pain, unexplained symptoms, come get your implants out because it definitely could be a possibility. But you know what, if you want to keep your implants, which some patients do because they love their breast implants, that's why they got them to begin with. That's up to you. I mean, we don't discriminate. It's like, if you want to leave your implants in, that's fine. I made the analogy earlier. If someone told me that I had to get all my teeth pulled out because I had, dental implant syndrome or whatever you want to call it, I would really think twice about that because, I got my implants for a reason and I like them. So it would be a big commitment to take all my teeth out. So I understand where people are coming from, and I think it's an individual decision.
Oh,
Looks like we have another question here.
Keep
So
going as
Lynn,
long as we've got time.
yeah, one more question, one last question. Lynn asks, how do we detox after explanting?
Well, that's a really complicated question. Yeah. And so there's lots of different things that people can do to reduce inflammation in their body. There's a lot of those biohackers out there that, offer different types of solutions for patients that have inflammation. I think that stuff works well. That was actually a lot of what helped me feel better. I actually came today from, doing my own biohack regimen in the morning. I do like red light therapy and infrared sauna, cold plunge, IVs, glutathione, all that stuff. I can kind of run through the list. So that, to me, supplementation has been very important. But you want to make sure you're getting it from a reliable source. we can definitely include all that on our centers of excellence as a resource for patients that are looking to better understand how to get the inflammation out of the body. And really, that's what it comes down to. It's like, where's the inflammation? It's in your cells. How do we get it out? There's lots of things you can do about it.
Perfect. Thank you so much, Dr. Pryor, Laura, Danica. This was truly an incredible presentation. We're so grateful for your knowledge, for what you're doing to advocate for women, and because you truly are helping so many women heal. And to me, being a BII survivor, that means the world to me, because there are a lot of women suffering and they don't have a voice. And you're being not only that voice, but you are being that healing modality for them to be able to get their life back. So thank you so much for being here.
Yeah, it's our pleasure to be able to spread the mission. And I would say if patients, if anybody has questions, either for yourself or for a loved one, even if you don't want to get explanted. Oh, by the way, I was going to say, if you don't have the financial resources to get explanted, we're also working on putting together a 501c3 charitable arm to the BII Centers of Excellence, so that patients that can't afford explant surgery will be able to get it through this charity. So, stay tuned. We don't have that totally operational yet, but it's definitely coming.
Amazing. Thank you so much. We appreciate you being here.
Oh, sorry,
And
I didn't answer I didn't finish what I was starting to say, which is, if you have questions, just talk to Laura or talk to Yvette. I'm sure we'd be more than happy to just answer questions for you. If you have specific things you want to ask, they're basically available 24/7 just as a resource. Send us a note and we'll definitely get back to you and answer whatever questions you might have.
wonderful. And I'll even put all the information in the top of the post and in the comments. So if anybody wants to connect with you, they're going to have that information in this. So thank you so much.
Perfect.
Well, thank you for including us. And yeah, we're very blessed to be on this journey with all of you. I am in particular, because I can't say I'm a survivor of breast implant illness, but I know what everyone's going through.
And maybe, that can be a good thing, because then you empathize and understand more with these women. And that's to me, that's the most incredible physician. So thank you, Ken. We appreciate you. And for all of those watching, we're going to take a short little break until the next presentation. I'm going to be presenting next with the gut health microbiome, biofilms, and mold. So stay tuned. But again, please, all the information, I put the BI Centers of Excellence website in the post. So if you want to reach out to Dr. Pryor and his team, please do, because they're doing some incredible work. So everyone here in the meeting, please stay here, and we will be back here in just a few minutes.
Thank you.
Thank you.